All right, so we are going to start going over a lot of different topics as we start getting into this course. This is really going to be the meat and potatoes of this course. All right, so how the next couple weeks are going to go and how this is going to get set up is a lot of times we're going to have two topics a week that we're going to go over. And what I'm going to do is I'm going to record two separate lectures for each topic. Generally, how we're going to go over things will focus kind of on what the disability is, uh, kind of start going over some of the ramifications, and then we are going to talk about how we actually address students that have these disabilities. Okay, so just to kind of give you an idea of how this course is going to look going forward, it's going to be slightly different, but not by much. Okay, so we're going to start with intellectual disabilities. So, what do you need to know? Well, first off, what an intellectual disability is. And we're going to talk about that in a second. We also got to know what adaptive behavioral is. Adaptive behavior. So, it's conceptual, social, and practical skills. All right. And we're going to go over that. But make sure you focus on that in your reading for this chapter. So, first off, how do we determine that a student has intellectual disabilities? Well, pretty simple actually. We go as we started this course, and I know you guys are probably sick of me hearing it. Starts with a referral, goes to the administrator. Administrator says, "Yeah, we got to go and evaluate." An evaluation occurs. All right. Now, for intellectual disability, and we don't go into it too deep in this course, but what needs to happen is uh, during the evaluation, what we have to test for is IQ. We got to test their achievement. We got to test. Normally, we will have speech. Take a look at these children. Also, uh, we also need to have what's called an adaptive behavioral skill, and we'll talk about that a little bit more. And and I'm sure I'm missing something, but we need some observations. But once again, in that planning meeting, we're going to divvy out all of these different tasks, okay? So, one of the main things, though, is going to be an IQ test. Now, in this course, we do not go over IQ scores a lot, all right? But IQ is measured through the mathematical concept called standard deviation. So, what is standard deviation? Well, it's how a particular score deviates from the average scores. To be diagnosed with an intellectual disability, a score must be two or more standard deviations below the mean. So, there's a whole lot of things. What I can tell you is, by and large, children with what I normally go by is the average IQ is right around 100. Okay, students with um, intellectual disabilities, their IQ score is going to be below 75. All right. Generally below 70, but below 75 at least. Okay. Now, what is an IQ score, though? And we won't go into this a ton, but what an IQ is actually, when we hear an IQ, we think of just a number. What we don't realize is what an IQ test actually is a whole lot of different little subtests put together, and then all those scores get added up, and that is the full scale IQ that we hear. All right, so and we'll talk more about that when we talk about different topics, because some of those subtests are actually more important for different things. One of the subtests measures processing speed, for example. And one of the things we know is students with intellectual disabilities may have a slower processing speed. All right, so it's not that they can't connect the concepts, it just may take them more time to do so. All right. So, anyways, that's what the IQ has to be. It has to be below 75. The other thing is an adaptive behavior skill has to be has to be done, and the student has to show some clinically significant or at least some very low ratings to qualify for intellectual disabilities. So the collection of conceptual, social, and practical skills that have been learned by people in order to function in their everyday lives. And these include conceptual, social, and practical. So what does this mean? Well, one of the things it's going to ask a test on this adaptive behavior scale. What normally happens is a teacher gets one of these skills, and it's just uh, basically like a survey. Can the child do this? And how well can they do it? Uh, on a bunch of different tasks. So it may ask, does the child need help cleaning themselves when they go to the bathroom? Do they need help tying their shoes? Are they able to navigate the classroom environment? Are they able to navigate the school environment? So normally, how this works is the teacher gets one of these rating scales, and so does the parent. And between both of them, these results go to the school psychologist who puts it into a program. It spits out a score, and it's going to show, is there a deficiency in conceptual skills or social skills or practical skills. There has to be a deficiency somewhere for the student to qualify for intellectual disabilities. Um, so, age and disability. Age determines a scale that is used to diagnose disabilities. So, adaptive behavior scale, there's two parts used for school age children. So, this is talking about the DABS, which is a diagnostic adaptive behavior scale, ages 4 to 21, used to help determine intellectual disabilities. And what we normally use, at least in my school, we normally use the Violent Adaptive Behavior Scale. You don't need to know the specifics of it, but there's three different versions depending on what age the child is determines what version the teacher gets to fill out. And the reason that's important is we expect certain skills at certain ages. So, obviously we expect a 12-year-old to know how to clean their bottoms when they go to the bathroom. However, a 4 or 5-year-old, it's a skill they may still be learning, right? So we understand that there's some differences in the ages, and that's why there's a different behavior scale for different ages. So, in both IQ and adaptive behavior scales, social and cultural biases can be a problem. What is considered an appropriate action in one setting by one group may be considered inappropriate by another. And that's something we got to be cognizant of. So, for example, just because and a lot of times we got to look at it, especially with adaptive skills, we got to sometimes look because, quite frankly, and I'm going to be blunt, sometimes students are a little bit delayed on some skills because their parents may not allow them to do it, or kind of teach them how to do different things. So for example, we've had students in the past where maybe mom ties their shoes every day. Mom, they do certain things instead of letting the child learn how to be more independent. Mom is kind of taking over. So is it really something we can hold against the child for not knowing how to do? Not really, because they never had the chance or opportunity to do those skills. So we got to sometimes take that into consideration. We also got to understand, we're looking at IQ scores. We got to understand that even though IQ is measuring the potential a child has for learning, we also have to understand that early education does play a small part into that. Uh, the earlier the brain starts getting moving and different skills get learned, that could impact the score a little bit. We also have to understand what trauma does to a child. So I said before, 100 is a normal average score for IQ tests. Well, what research has shown is trauma can actually drop the IQ scores by up to 20 points. So a student could be average, but maybe went through a lot of trauma. All right. So that's something else that we got to be cognizant of. So there's some bias that we got to take into consideration when we get these results. We got to take a lot of things into consideration before we're willing to label a child having intellectual disabilities. So what are some characteristics of students with intellectual disabilities? And before we go any further, I want to mention, and I know this was mentioned previously, but the previous term for intellectual disabilities was actually mentally retarded. All right? We do not use that term anymore. That term has now changed. It was actually cognitive disabilities, and now it's intellectual disabilities that they have changed it to. There are still some things actually in the law that still refers to these students as mentally retarded. Okay, so there's still some text that's a little outdated, even in our current laws, that we got to be cognizant of. But when you hear that term, think intellectual disabilities. But, anyways, what are characteristics? Well, some cognitive functioning is going to be a little bit lower in some areas. So maybe their memory isn't good. Maybe they have a better long term memory than they do a short term memory. Um, Maybe they're going to struggle to pull that information out. That's another issue. And the example I always give with that one is if you ever were talking and you were trying to think of a certain term and it was on the tip of your tongue and you just can't pull it out. That's sometimes what our students with intellectual disabilities go through. Not just with terms, but when speaking, but a lot of different things. And obviously could be very frustrating. Also, the learning rate may be a little bit lower, right? So they may take them a little bit longer to learn different concepts. The attention span may be hindered. So our students with intellectual disabilities, they may struggle paying attention. The big one is generalization. So not just learning something in a classroom, but actually being able to apply that in a real world setting is very difficult for our students. So, for example, we may talk about, in class, how to do, one of the examples I like to give, what I used to do with my students, is we would actually learn something and then go on a field trip to actually help them generalize it. So, for example, we would talk about how to behave in a restaurant. We would talk about how to make, how to make change. For example, when you go to a restaurant, a meal comes to $7. You have $20. Well, because our students are more prone to getting ripped off, we got to help them to do some simple math. Like, okay, we got to do 20 minus 7. Okay, I should expect $13. We talk about leaving tips, but we talked about that in a classroom setting. But our students, when they actually go to the restaurant, sometimes they have to relearn it because they're not generalizing that it's the same concept just in a new setting. So generalization sometimes can be very, very hard for our students with intellectual disabilities. Finally, motivation. Our students, if you think about something, if you think you're not good at something, you're not going to be very motivated to do it. Learning for our students with intellectual disabilities is hard. I know me personally. I'm guilty as charged. When I don't want to do something, and you can ask my fiance, when I don't want to do something, I just don't do it. Or I don't have the motivation to do it. I hate folding laundry, and I will do anything not to fold laundry. Okay? I'm not very motivated to fold laundry. Eventually, I will get to it, but I'm not very good at it. I'm not. My towels, when I fold towels, they just end up in a ball. Okay? They're not good, so I'm not good at it. Not motivated to do it. I don't like doing it, so I try not to do it. Our students with intellectual disabilities are the same way. Learning is hard. It's hard for them. And when something's hard and you don't want to do it, it doesn't come easy, you just don't have that motivation. So our students with intellectual disabilities need some pep talks from time to time. When it comes to adaptive behavior, self-care, and daily living skills, it's going to be very difficult for them. They're going to need reminders to brush their teeth. They're going to need reminders to wash their hands. And yes, I say wash. I live right on the Ohio-PA border. Don't judge. Anyways, they also are going to need reminders to shower, put on deodorant, things like that. That's going to be hard for them to remember. Sometimes they're going to struggle cleaning their bottoms when they go to the restroom, things of that nature. Their social development may be lacking. They're going to struggle making friends, for example, and that's common. They may lack just knowing how to ask for help or who is appropriate to ask for help from. And then finally, they may have behavioral excesses and challenging behaviors. Okay. And a lot of times, and we'll talk about this more next week. I believe it's next week. We'll talk about more. We're going to talk about the functions of behavior a lot more, and this will make a lot of sense. But long story short, our students, once again, when you don't want to do something because it's hard, you act up. And behavior is communication. Every behavior is communicating something. And a lot of times our students are trying to communicate that learning is hard for them and they need help. Um, or they just don't understand it. Or sometimes they just don't want to do it because it's so hard for them. And we got to understand that. So our students with intellectual disabilities may have some adaptive behavior, and they will have some adaptive behavior deficits. So what do we do with these students? Now, we may talk, if we have time at the end of this semester, I'll talk a little bit more about it. But depending on where the student is at, sometimes they will follow the Ohio Learning Standards, the general curriculum. Okay, so they'll focus on reading, writing, and math. For our students that are able to follow the normal curriculum, that's great. For our students that still struggle, what is a modification that could be added? And I believe the students that the student that I gave the sample IEP to on the IEP scavenger hunt, they actually qualify for this. It's called the Ohio Learning Standards Extended Standards. The extended standards are, for lack of a better term, the watered down version of our regular standards. And the extended standards are supposed to focus, they don't always do this, but they're supposed to focus on the most important foundational skills in each one of the topics. So as you go through your courses, your educational courses, you're going to learn a lot more about the Ohio Learning Standards. Just know that there's an other version available for our students that have intellectual disabilities that sometimes they may qualify for, called the extended standards. And once again, these extended standards are watered down versions, or they're supposed to be. They're supposed to focus on functional skills for these students. Now, the downside is a lot of these students, and we'll talk a little bit more, I don't want to confuse you, but for a lot of these students, they're still going to get tested on the main standards, even though they may have been taught off the extended standards. It's unfair that they do that in Ohio, but that's just kind of how it is. There's no way around that. Anyways, our students are still going to need to know how to read, write, and do math, even though they struggle with these concepts. Now, what we're going to try to do, though, is focus a lot more on the functional curriculum, though. And we got to think sometimes, will learning this skill help the student be more independent and successful in the home, school, or community? And will failure to learn this knowledge or skill have a negative consequence for the student? So, the example I love to give is, an analog clock. We have spent, I'm not saying the students with intellectual disabilities can't learn it, because they can. I know they can. I've seen them learn it, how to tell time on an analog clock. My question, though, is that functional? Is there an actual purpose behind that? Because, quite frankly, I have a cell phone no matter where I go that has a time on it. So, there's devices that I have, there's a device on my pocket that tells me the time. Do I need to know how to tell an analog clock? And more importantly, spending a month teaching that skill to a student with intellectual disabilities, does that help increase their quality of life? I'd argue in some cases, maybe many cases, the answer is probably no. So there's other skills that we may need to teach them that are probably more relevant to them and more important that they learn, like how to behave in different situations. Other safety skills, like who can you ask for help? Things of that nature is very important. So a functional curriculum is going to focus on the most functional skills to help increase their quality of life and how to increase their eventual productivity after high school. So what is some effective instructional methods? So one of the things that we like to do is what's called a task analysis. So when we teach different things, a lot of times when there's steps, we got to break those steps down. We got to break these steps down for these students. So with our students, they may struggle if you give them 4 steps. But if you lay them out one by one by one, they're able to complete each one. Okay? So task analysis is very important. And sometimes with our students, what we do is we'll give them a little checklist. Um, did you do this? Check it off. Okay, after you do this, then you do this. Did you do that? Yes. Okay, now I go step 3. We're trying to build independence. But first, we got to break those tasks down. Instead of one big task, let's break it down into simple steps to help our students. Also, we have to have an active student response. So what I like to do is, and this actually kind of goes with systematic feedback also, um, we got to understand what the student's trying to tell us and how to give feedback to them promptly. Students with intellectual disabilities, they need feedback now, okay? If you wait till the end, they're going to forget, or they're going to struggle to really apply that feedback you're giving to them at the end of a task. So prompt feedback is very important for them. Also, we got to transfer stimulus control, and this is very hard. So when I worked in a classroom where I had 6 aides, I had to do a lot of work with my aides actually, because we do a least to most method, or sometimes we do a most to least method. And let me explain what that is. When it comes to prompting, we want to give our students the ability to be as independent as possible. So a lot of times our students with intellectual disabilities, they may struggle at first, and we may have to do hand over hand prompting with them. That's the most. When it comes to prompting, that's the most. We're doing the most. Um, well, while that's appropriate in some settings, we have to know how to give that control back to the students. Maybe we're not, maybe we start the week doing hand over hand for an activity, but by the end of the week, maybe we are just there giving, physical prompt or verbal prompts, whatever it may be. We got to learn how to fade those supports back, because at the end of the day, after 12 years of education, or maybe 13 in some cases with our students, they're probably going to go out into the real world, and they're not going to have that hand over hand assistance. So we got to give them the ability to be independent. We also have to have direct and frequent measurement. So we got to constantly measure our students meeting the goals that we need them to meet. So what's the purposes of functional curriculum? Well, it increases independence, self-direction, health and fitness, and enjoyment in everyday life. Now, by building independence, self-direction, guess what? We're increasing their quality of life, because we're trying to prepare them to have a job after high school. Most of these students are not going to go to college. I have seen it. I'm not saying it's impossible. On the rare occasion, students with intellectual disabilities will go to college. But by and large, these students are going to work in the community, and we need to help them get some independence and self-direction. We also got to help them have some recreation, right? So we may need to help them even in the school setting. How do we have fun? What's appropriate? I know with these students, one of the rewards I gave my students that had intellectual disabilities is I brought my old Super Nintendo in. And one of the rewards is they get to play a video game. If they did really, really good, throughout the week, on Fridays, they could, have some time with my Super Nintendo. Well, that's an age-appropriate thing. Maybe not Super Nintendo anymore, but it's still the best game system for the record. Anyways, but playing video games is a very appropriate thing that people do. So once again, helping them learn those different skills, like even playing video games, even though it's not educational, it helps them get some enjoyment and increases their quality of life. So we got to think about that, and that's what the functional curriculum helps students do. It also gives some practical skills, like learning how to use public transportation, ordering in a restaurant, Telling time, once again, I hate analog clocks, but whatever. Cooking and food safety, we do a lot of cooking with these students. And we may be teaching measurement, you know, but we're teaching measurement in a context of how to cook and how to check food safety. So our students one day can cook themselves. Furthermore, we teach them nutrition and fitness so they can learn how to be healthy. Um, so those are some things that a functional curriculum helps provide. That's all I'm going to go over with the students with intellectual disabilities at this time. What I'll do is I'm going to upload this video, and I'm also going to upload the video for specific learning disabilities. That way I'm breaking these two down just because sometimes I know you guys are busy and you may watch one video, but you may not have a full time for both topics. So that's why I'm splitting these up, and I hope that makes sense. But if you have any questions, feel free to reach out.